Hello everyone, welcome back to this channel. Today I would like us to talk briefly about delays in accessing health services. This is a component of service delivery that hinder effective service delivery. So service delivery is one of the health system pillars as given by the WHO framework for Action 2000. In the framework, according to WHO, there are 6 pillars whose overall goal is to improve health, responsiveness, social and financial risk protection, as well as an improved efficiency. And these are moderated by access, coverage, quality, and safety. When we talk about service delivery, is delivery of effective, safe, good quality personal and non-personal healthcare services to people who are in need. And these services could be promotive, preventive, curative, and even rehabilitative. For effective service provision, we require trained and competent healthcare personnel. We require the right medical supplies, adequate financing, require health information, among others. There are priority areas in health service delivery. For instance, demand for the services, package of integrated services, organization of the healthcare provider network, management of these services, infrastructure, as well as logistics. When I talk about delays, we mean factors which may stop or prevent patients from getting the healthcare services that they need. Remember, in our constitutions, it is documented that everyone or every citizen has the right to access to the highest attainable standards of healthcare. People who need these services should be able to get them without experiencing any form of barrier. And the barriers could be financial, geographical, and even the languages that are used in our health systems. There are 3 levels of delay, where in some texts they are referred to as stages. And these delays could come either from the demand side, that is from the patients, or from the supplier side, that is the healthcare providers or the health system. For level 1 delay, it is divided into 2, that is appraisal delay as well as the illness delay. When I talk about appraisal delay, this is a time the patient takes to appraise a symptom as a sign of illness. This means there are people who fail to realize that whatever they are feeling is either something normal or abnormal. They could be sick but they don't know. So that awareness of the symptom or the feeling that one has, or failure to appraise that as an illness, might cause delay. The other delay under level 1 delay is the illness delay, where this refers to the time taken from deciding that one is ill until deciding to seek for healthcare services at a facility. Someone might be feeling unwell but ignores the signs and symptoms. And in my previous video on health-seeking behavior, I talked about men having a poor health-seeking behavior compared to women. Men feel that they they are strong enough to overcome certain illnesses even without going to a hospital. There are people who consider some signs and symptoms to be self-limiting, and therefore they don't need to go to a hospital. However, they don't know that they are exposing themselves to danger. Some do so because of maybe religious beliefs, where some religions do not allow their members to go to hospital when they are sick. They would rather go to church for prayers than going to a hospital. There are also those who believe that the sicknesses they are experiencing are as a result of witchcraft. There's somebody's hand that are involved in their sicknesses. So they would rather go to a witch doctor than go to a hospital. And when all these are happening, they are delaying themselves from seeking health services. The other one is as a result of the financial constraints or issues. Remember, if one is not covered by medical cover, in a country where citizens are not under any medical cover, they are forced to pay out of their pocket, right from transport to the facility when they are sick, paying for consultation, paying for investigations that are ordered, paying for medications and everything out of their pocket. So when an individual is sick and is not under any medical cover, they'll spend a lot of time looking for money to enable them cover the medication cost or their illness, resulting into a delay. There is a level 2 delay, where in level 2 is the time from the decision to seek care until the patient goes to a hospital. This is when an individual has realized he or she is sick and is ready to go to the hospital. So the delay here could be as a result of getting an appropriate means of transport. The ideal means of transporting a patient to a health facility is an ambulance, but not everyone has access to an ambulance. Depending on the country's health systems, there are those who can have access and there are those who don't have that access to ambulance services. Other delays in this level will be as a result of poor road network or the distance that has to be covered from where this individual is to a nearby health facility. In high-income economies, we know the distance from one facility to another is less than 5 kilometers. But in low-income countries, you'll find health facilities being over 5 kilometers away from the people. So the traveling time, the distance that has to be covered is long. So this also causes delay. For level 3 delay, this is where now the patient has reached the hospital but is unable to access the services they have come for promptly. They still have to wait for long before they get the services. This delay can be as a result of the provider factors or the health system factors. The provider factors that we can talk about is the healthcare provider being unable to handle the condition that a patient has presented with. So time is spent looking for the skilled healthcare provider who is able to handle the condition or the case. The other one is the healthcare provider's attitude. There are certain or some healthcare providers who naturally have negative attitudes either towards certain conditions or certain patients. depending on how these patients or their relatives present at the facility. Remember, the mission of the MEDICs is to alleviate suffering by the patients, treat and cure where possible, and even to help the patients cope with illness, disability, and even in times of death. So the health system factors that we can talk about are, for instance, inadequate staff. This is where now one healthcare provider has to attend to very many patients. And because they're human beings, they end up having burnout. So there's long waiting time among patients before getting the services that they have come for. The other health system factor is infrastructure. If, for instance, the facility has operating theatre and it is only one, and yet the patients that need such operations are many, then the waiting list has to be long, and the waiting time as well will have to be long. Then the other factors are policy related. For instance, in lower level facilities, the primary level facilities, we know in some countries they are not operating 24 hours. So if a patient comes before the opening time is up, then they'll have to wait until such a facility is opened. So they'll be having delays in getting the services. The other one is because of the policies dictating that a certain level of a facility has to have a certain specific resources. So in a situation where a patient comes to these lower level facilities and the resources that they require are not there, so time is wasted looking or going to higher level facilities to get these services, and yet they've spent most of their time in these lower level facilities waiting for the services. The other one is non-functional referral system. The aim of referral system is to ensure prompt and continuity of care. But if it is non-functional, then patients will spend a lot of time waiting to be referred to higher level facilities in case they need services at those higher level facilities. And with that, we've come to the end of this presentation on delays in access to healthcare services. I'd just like to remind us that everyone has a role to play, whether it's the patient, the healthcare providers, and the health systems in general. They have a role to play in ensuring that everyone who needs these services is able to access them whenever and wherever they need these services. Thank you very much. Let's meet in my next video.